Watch me reverse decades of sun damage and take my patient from this to this. For this patient, we chose to do a series of IPLs, or intense pulse light therapy, which uses a broad spectrum light to target brown spots, age spots, sunspots, capillaries, redness, uneven skin tone, you name it. It is such an incredible, powerful device. However, not everybody's a candidate for this treatment. Those that are great candidates are those with lighter skin tones, like fair to medium skin tone, and those who have a good amount, moderate to severe sun damage. You could do it for freckling as well, but those that are not a great candidate are more important. Those with darker skin tones, as it can cause post-inflammatory hyperpigmentation or even darker patches on that skin. It can also strip away good melanin that we want to keep. Other poor candidates for this treatment are those with melasma. Melasma can worsen with any heat-based device such as an IPL. So it's important that you really sit down with your patients, or if you're a patient, that you really sit down with your provider to determine if this is the right treatment for you. For example, I have fair skin, so by my skin color, I'd be a great candidate for this treatment, but I have a strong underlying melasma concern. So I would never, ever, ever do an IPL, as it would probably worsen my melasma. Now join me as I take you along her healing journey from her first and second IPL. Now this is her receiving her treatment. It looks like a laser device, but it's not. It's a broad spectrum light. But you can see that I'm really slowly treating that skin. We chose to do face, neck, and chest for her, so she got all three areas. We started off with a little bit of topical numbing, and she's using Pronox. That's what she has in her mouth, which is basically laughing gas. It helps just relax her. She can drive afterwards, so that's not a concern, but it helps the procedure be a little bit more tolerable. There is a little bit of a mild discomfort with an IPL. Some patients say it feels like a small rubber band with each little zap. Some patients tolerate it really well. Others need topical numbing and laughing gas. So it really depends on the patient whether you can tolerate it or not. So chat with your provider or discuss with your patient whether they feel that they need other options to make it more tolerable. Now, this is what she looked like immediately following our first treatment. She's red, her skin is inflamed, it looks angry. This is exactly how I want her to look. She probably feels a little bit of a warm sensation, but it should go away within about 30 minutes. I told her to go home, and her goal is to keep her skin super hydrated for the next week to create a really moist environment for better healing. Now, this is how she woke up the next day. You could see where that treatment really targeted those brown spots. Over time, those brown spots are going to start to soften and flake off over the next week or so. So then the next day, fast forward to day 3, she woke up super, super swollen. Now, this can be normal. This happens often. And in these events, I always tell my patients this can happen. It's normal. Don't be alarmed or concerned. I called her in a Medrol dose pack or a steroid, and you could see immediately the next day the swelling was nearly completely gone. So no concern. It's just that inflammatory process that our skin is going through, so swelling can happen. Now, as we progress through the healing phase, you can really see those browns start to lighten, start to slough off, flake off, and really see that baby fresh skin exposed underneath, that clean, clean canvas. Now, you're probably wondering why we always say 2 to 3 IPLs and not just one. One is specifically for a patient. If you look at her before photos, one treatment is not going to be enough to really clean up the canvas of her skin. You really want, basically how we look at it as an IPL, it's going to grab onto those brown spots, and then those brown spots are going to start to slough off. And then the second treatment is going to grab onto what was missed or deeper browns that were underneath and then flake off. Sometimes you even need a third IPL treatment, and that's okay. Then you fine tune those areas, grab more brown, and then those flake and slough off. So doing a series of 2 to 3 IPLs is typically recommended. So you can really see how beautifully she healed from just one IPL treatment. This is her presentation at her second treatment, about 4 to 6 weeks after the first one. This time, I really wanted to take time to fine tune the browns that I missed, or that the device missed, but really me. So really, I wanted to focus. You could see in that hairline, I had to get really close this time to make sure that I hit those browns so that she didn't have this brown strip. I also missed a few on her chest that I really wanted to target, but this time I really spent time and fine tuned the spots that were missed from the first treatment. Her healing for this round was a lot less intense because remember, there's a lot less browns to grab onto this time. We did proactively put her on a Medrol dose pack just in case she swelled like she did the first time, but she didn't. She had a great healing process, and look at these before and afters, guys. Profound, remarkable. I mean, these before and afters are incredible. She's lost years of her life. She looks younger, she looks cleaner, she looks rejuvenated, refreshed. She was nearly in tears with her results. I am thrilled with this, but it does take a provider knowing who would be a good candidate for this because you really can hurt somebody if you don't choose the right patient for this treatment. Again, great candidates are those with fair to medium skin tone, with sun damage or broken capillaries. This device is great for broken capillaries or uneven skin tone, but those with darker skin tones, such as a darker Hispanic or an African American, or those with melasma, are not great candidates for this treatment. You could really strip their beautiful melanin skin and you can really do damage. So it's crucial that you ask questions to your provider, or if your provider, make sure that you talk to your patients about their skin history, if they have any history of melasma that you're not picking up on right now, because you can even trigger melasma to start. So I really, really, really want you guys to pay attention to this, but look at how incredible these results are. If you have any questions, comment below. Happy to be a part of your journey. I hope this helped kind of clear up some questions on how you can heal from an IPL, but thanks for watching.